Hi, Kris.
Hi, how are you?
Thanks for joining today.
You're welcome. Happy to be here.
Yeah, I'd like to talk about a little bit about yourself, your role, kind of the way you see things evolving in the healthcare industry, and then a little bit of vision ahead and how you're thinking about going forward.
Okay.
So let's just start off. Maybe if you could tell us a little bit about yourself, your background.
So I am a family nurse practitioner by training. I have been in the space of a very long time. So not to date myself, but a nurse practitioner since 2006.
Oh, gosh.
So yes, been through lots of iterations of healthcare and the different phases of things. And it's just been a real honor, and it's been a lot of fun to kind of work in this space. I work currently at Prisma Health. I'm the director of NVO Strategic Health and Business Solutions. And my role there, it is still a clinical role. So my role is to kind of work in the value-based space, but to understand how to operationalize that for the clinical folks. So how do we take the data that we're acquiring from Innovaccer and how do we incorporate that into practice in a way that makes sense for those that are actually practicing day to day?
Say a little bit more about NVO and how does that relate to the larger Prisma Health system?
Yes, so NVO is our network, and so really, truly, Prisma sits within the NVO network, so it's sort of the umbrella over the health system. And so we have many independent providers that are under the umbrella along again with Prisma. So we can make strategic decisions, kind of from the broader level, and those can filter down into to the smaller entities.
So you've got some people within the Prisma system and then other people that are in practices that are in different systems.
That's right. That's right.
So how does that work?
So, it can be tricky. When we have the health system, we have, I think, a little bit more control over how things are done and how we're structuring and expectations, of course, quality expectations. When it comes to the independent providers, you really don't necessarily, it's a fine line. It's a dance that we have to do to make sure that we're respecting the fact that they are independent, but we are trying to help to bring them along and ensure that their quality is where it needs to be, and supporting them in any way we can, whether it be providing Epic, that's one of our big MSO offerings, just again, so that we can procure the data to give back to them in a way that they can shape their practice to improve their outcomes.
And add value to the care that they deliver to patients.
That's right.
Now, you started as a nurse in
I did.
Direct clinical care.
Yes.
What kind of drew you into doing more strategic work?
Yeah, it's definitely been an interesting path. I think really it was more trying to be instrumental in ensuring that what I was doing, it made a difference, and that I could affect those changes as opposed to being kind of affected upon, if that makes sense.
Absolutely.
And I really just, always have enjoyed kind of taking things to the next level and thinking innovatively, and being able to communicate those things with my peers, and it's been a lot of fun. I've enjoyed it.
Sounds like a natural draw for what you found exciting.
Yes.
Fast forward to today, what do you find most exciting about your work, most gratifying, and more importantly, what do you find most challenging?
Yes, of course. I think the most gratifying thing is again, along the same vein, is just really creating programs that make our clinicians function at the highest level, and understanding that we are trying to do things not to add complexity, but to take it away and to help them be able to spend more time with their patients and make sure those encounters are quality, both from a system perspective, but also their job satisfaction and our patient satisfaction. Prisma is always very patient-centric, and that's what drives all of us to do what we do. And with all of the things that our providers are being asked to do, all the boxes and practice advisories, it can be a very overwhelming and daunting task for them. And so just trying to represent that and help them to get these necessities done, but in a way where they can still feel like they're practicing in a way that they wanted to and enjoy. I guess that leads me into the more daunting things, and I think it is that. The expectations grow and grow, and sometimes these are decisions that get made by people that don't see patients every day, and they don't necessarily understand why what you're being asked to do is complex and difficult, and why can you not see more people, and why do you need 15 minutes as opposed to 7 minutes, and all of those things it's a challenge when you don't do that work every day.
Sure, and there's two parts to that,
Yes.
I would think. There's the administrative things
Right.
being asked by the system.
That's right.
And then there's the evolving landscape with regulatory pressures and new expectations and new models of care.
Right.
How do you navigate that?
It is a challenge. Again, I think it's just more of trying to optimize what we can for the providers, and just kind of anticipating what's coming down the pike and trying to enable them in any way that we can. And innovation is going to be their friend. It really is. And as we talk about AI and those sorts of things, it's provided the clinicians the opportunity, as we just said, to be able to spend more time with their patients. We just rolled out something at Prisma where they're able to do some AI dictation. So their notes are being created while they're having their encounter with the patient. So they're not having to, constantly look at screens and back and forth and, try to have a heartfelt conversation, but yet have to run out and try to remember it all and get it in a note. So these things are, they're highly advantageous for the providers.
And look at the patient instead of the computer.
That's right.
Yeah,
That's
that
right.
sounds like a wonderful new world.
Exactly.
Now, in Vivo, it kind of sits between a payer world and a provider world in some ways. What's that been like?
So truthfully, I don't have a whole lot to do with the contracting piece of it. And so, again, those, Dr. Leonard, who you will interview later, he has a lot to do with those. And so once they have created those agreements, then that sort of rolls down to our teams, and we just have to figure out how to make that all
What to do
unfold.
with it.
That's
Yeah,
right. Yeah,
that's
that's
right.
how to operationalize those requirements. Yes.
Now, there's these new models that are coming out. We have a new administration in Washington. It's a very different administration.
Yes.
And we're seeing these new models come out like Access and Lead.
Yes.
How are you thinking about that from a strategy standpoint?
Yeah, in truth, I think those things are things we've worked on extensively anyway. I mean, so access is an issue for all, I believe, all health systems, universally here. And so radical access is something that Prisma has prioritized strategically this past year. And so really we're trying to be a same day, next day organization. So, that is difficult, but we're trying to employ solutions that will make that happen. And we're pretty proud of that. As far as, Lead, trying to keep people healthy and once we have gotten them in, trying to make sure that all of the boxes are checked and that their needs are met so that they're not getting readmitted or winding up in the emergency department. I think one of the programs that's near and dear to me is our direct primary care. So we just started offering that 3 years ago. I built that out for our health system as part of a Promise Health Plan initiative, which is our health plan that we started 3 years ago. And with direct primary care, it's a capitated model. So essentially it's a per member per month as opposed to fee for service. And the members have unlimited access to their primary care provider along with navigation services. So if they need anything in addition to primary care, the navigator is jumping in. They can be reached 24/7. They're looking at the most cost-effective place to refer for specialty care. Pharmacy services are included as well as lab services. So it's a very all-encompassing service, but it also reduces the fear, I think, associated with those of us that are trying to navigate a fee-for-service world.
For patients.
Yes.
Yes.
Yes. We sometimes feel like we're functionally uninsured because of deductibles and things like that, where these folks have no fear. They can come, 8 times a week if that's what they want to do. They can call 20 times a week. And so they establish these really nice relationships and don't wind up in the ED, don't wind up having an A1C that's 10 that they never knew about, because again, we have embraced that and we make sure that all of these people are being seen and treated, with a high touch.
I've had some people describe the patient experience as being in a pinball machine, kind of bouncing around between things, trying to figure out where the next step is.
Yes,
so it
exactly.
sounds like you're providing a lot of solution to that.
That's exactly right. That's it. It's their care hub, and there's really nothing that doesn't come through the hub for them. And so, they always, if they have questions, if they do have specialty care, the provider is calling them after. Did you have any questions? Did you get what you need? And so, again, it's bringing everything back to the hub.
I know every time I've left, and as a physician, I am a patient as well, I have my hand on the doorknob, I leave, and then I'm like, oh, I forgot to ask these questions.
Yes.
Or I can't remember exactly what I was being told. Is this approach kind of helping with that as well?
Absolutely. And they have longer visit times for that very reason. So on average, a routine visit, not a new visit, will be 30 minutes. A new visit is an hour, because they're taking the time to really understand this individual. What are the psychosocial aspects along with medical aspects? I mean, they really want to know everything that's happening so that they can address their care appropriately. Because a lot of the things that are going on with people's health are things that are happening in their environment. And, they want help with that. They need to help with that.
How do you help to summarize all that information and make it digestible? So in the patient, physician, or nurse patient encounter, how do they have that available?
Right. It is a lot, and it's a very different approach to healthcare. And so even people that are in healthcare every day, they're like, well, now that's what? You're doing what? And so we are very accustomed to trying to explain it. But I think essentially it's more just call.
Yeah.
You have access to us 24/7. Just call if you need anything, and we will do the same. And
It sounds so wonderful, because
Yes.
I think for many patients, they have to wait 7 months for the next appointment.
Yes, right.
And to have that sort of immediacy or availability,
right.
I would think that makes a big difference on how they feel the experience of healthcare is.
It really does. It really does. And our hope is, new things, it takes time for adoption. And there are certainly direct primary care companies that are national. But from our perspective, our vision for it was to be, again, maybe could we use our Promise Health plan, and could we carve out direct primary care as the primary care component, and then Promise would wrap around for, inpatient care, specialty service, that sort of thing, so that we could broaden that service to, a larger audience, focusing on employers as well, because a lot of them are self-insured, and direct primary care is something that can really help them to understand what their healthcare costs are going to be, and to help them plan, it's just every year up, and it's getting to be almost impossible to keep up with. So it's a really great solution. We're really proud of it.
And not so much fighting between payer and provider.
Right.
And
Right.
for employers, who 51% of the healthcare in this country,
Yes.
maybe a direct solution for them as well.
Yes.
So that's fabulous.
Yes.
Now, I heard you mention something earlier. You mentioned AI.
Yes.
Say a little bit about AI, what that means for Envio, for your work, and how you think about that.
Yeah. So I think, in truth, we're just sort of at the tip of the iceberg with AI. We're a big health system, so one of the biggest in South Carolina. And so, implementing things are always challenging. So we are certainly, I think, at the beginning of that. We're very hopeful that it will, again, provide, especially our providers and patients, with a better experience overall. Enable those interactions to be a little bit more intimate. They're not rushed and, trying to get everything done. So I feel like we have a open perspective to AI. I don't think there's a lot of fear. But again, I do think we're just kind of on the beginning of that journey.
And it sounds like that might be a little bit more palatable on the administrative side, some of the administrative complexities, than the clinical side, which may be evolving.
Yes. Yes,
Yeah,
exactly.
that sounds like a wonderful solution. So, looking ahead, like thinking beyond 2026, where do you see healthcare leaving? I think that a lot of people say AI may be an inflection point, a change in the direction. How are you thinking about that?
Yeah. I do think AI is going to be pivotal, and I think it's going to be a very interesting space to watch. And I think that we need to be very thoughtful universally on how we apply these technologies, and just making sure that it's, again, very thoughtful and that it's appropriate. And we don't, I think my biggest fear is, yes, there's a financial piece to it, but there's a human element to healthcare that really needs to be considered. And if we just look at, applying AI without, again, being thoughtful and how many jobs we could eliminate and all of those sorts of things, I feel like that's my biggest concern. It's the intersection between optimizing our providers with technology, but still making sure that they are driving the bus,
That's
so
right.
to speak. Yeah.
And I think there's a lesson learned historically. So, we all went through this idea of digitalizing healthcare, and we
Yes.
came up with the EMR.
Yes.
And there was a little bit of backfire in some of that, right?
Yes.
Burnout and patients back to the physicians back to the patient, et cetera, et
Yes.
cetera. Some people have said AI may be creating some more fragmentation, where you have AI for this or AI for that, but they're not connected. How do you think that can be resolved?
I think, again, going back to sort of thoughtful, strategic implementation. So having a unified platform that's really operating with the health system to integrate, these adjunct services, again, having a hub for that, and having, integrate into the EMR seamlessly. I think, having platforms where the providers are not integrated and you're asking them to log into a separate place and then come back to the EMR, again, be really mindful of who your end users are and what the problems are that you're actually trying to solve for them.
That makes sense. Kind of an operating system,
Yes.
but a technological backbone for that operating
That's right.
system.
That's right.
It's a wonderful vision. It sounds like your work, coming from a clinician as a nurse and then moving into strategy and thinking about connecting things and looking at these new models of care, can be very gratifying.
Yes, it is. It's very gratifying. I've really enjoyed it. And like I said, being in this space for so long, I've seen so much change. Just, to your point, I remember when HMOs came out and the $20 copay was just the biggest deal ever. I know I'm dating myself, but here we are, fast forward into AI and all of these things. It's been a great journey, and I've loved it, and it's offered me so many opportunities. Going from, I started out as a transport aide in a hospital, moving
gosh.
patients.
Yeah.
Why I put myself through nursing school, and then, again, kind of to where I am today. It's been a really fun journey.
Well, congratulations on a superb career
Thank
that
you.
you've had,
Thank you.
and an exciting one, I think, as well. And
Yes.
thank you for actually joining us today and spending some
Yes.
time to tell your story and talk about what you're doing at Prisma Health.
Thanks for having me. It was great. It was fun.
Thank you.